Hello, my name is Martinson Arnan. I'm a vascular neurologist. I'm also Vice President and Chief Clinical Officer for the Bronson Medical Group. We've been getting a lot of questions about whether it is safe to seek medical care at this point, and I'm here to answer those questions. In many parts of the world, including different parts of the United States, people who have adhered to social distancing have seen it work. We've seen it in Michigan, and we've seen it in the western part of Michigan. Because you've done your part by keeping safe distancing and washing your hands regularly, we've seen the curve flatten, certainly in our part of our state and in the entire state. That's important because that allows us as a system to deliver the care that you need now. We are ready and we've been caring for patients in this community and want to continue to do so. We are calling our patients, we are scheduling our patients, and we're making sure that you know that we have all the measures in place to be able to safely care for you. We want to say thank you to this community. Your support has really helped us to be able to continue to provide safe care. At Bronson, we don't believe that healthcare is episodic. We think it ought to be comprehensive and continuous. What that means is that it is not advisable to put off our healthcare needs. We believe that our entire community should still have access to ongoing healthcare. There are people in the community that have chronic conditions such as diabetes, end-stage renal disease, poorly controlled hypertension. Putting off the care of these conditions to a later time can result in certainly severe problems for a person's healthcare down the line. We have set up processes to allow us to safely care for all the medical needs of our community safely, even during this pandemic. We are reaching out to members of our community, we're reaching out to our patients and making sure that they know that it's safe to receive care. Some of this care is being delivered in our practices, making sure that we are observing safe distancing rules, screening people appropriately before they are cared for by our providers. We are also making sure that if a person needs some diagnostic tests, some procedures to be done, we've set up safe ways to provide this kind of care to all our patients. We have also made sure that although we have some small number of patients who have COVID-19 that we're taking care of, they are being cared for in a cohorted part of the hospital so that we can still deliver care, non-COVID related care, to people who need it here and now. We're also making video visits available when it is the right thing to do to be able to make sure that we can also care for patients at a distance in a way that is adequate and appropriate. So we're doing everything that we can to continue to provide care for this community as opposed to putting off people's healthcare needs into the far-off future. We have this line that anybody in our community can call. It is 269-341-7788. That number goes to our care advisors. Any question, any healthcare concern you might have, when you call that number, somebody's going to help make sure that you are giving appropriate advice and directed to the place where you can receive care appropriate to what you may have called about. Even if your question is about COVID-19 related symptoms, you can call the care advisor line and they'll make sure that you're connected to the right team member to help care for you. As a stroke doctor, I can tell you that There are some conditions that we don't wait on. If suddenly you had a loss of ability to move your face, your arm, or your speech changes, we say call 911 because you need emergency care. That might be true also for someone who might be having a heart attack. That might be true for someone who's had a traumatic accident. Our emergency rooms are safe because we screen people right through triage, and we're trying to make sure that we can continue to deliver emergency care that is COVID related and emergency care that is not COVID related. So if people have emergent healthcare needs, we're continuing to encourage them to seek care immediately in our emergency room because we know how to deliver that care safely. Safety is our priority. We know that keeping our team members safe keeps them healthy enough to be able to deliver the care they need to deliver to our patients. Additionally, keeping our patients safe helps to keep our community safe. And our mission is to advance the health of this community together with you. And so we have measures and processes in place to make sure that we stay safe. The measures and processes start even before one comes close to our facility. People receive phone calls to go through some screening questions even before their visits are scheduled. We also, through that same process, determine who should physically be seen or who can be seen via a video visit. Once you come to any of our facilities, there's an extra screening that happens to make sure that you're safe to receive care within our walls. We also make sure that everybody who comes to us is wearing a face mask to make sure that we are protecting one another. We are diligent about cleaning the rooms where we take care of patients and our waiting rooms regularly to make sure that all our surfaces remain clean. Additionally, we are very careful to observe safe social distancing even within our walls. So we make sure that our waiting rooms are not densely packed so that people would be able to receive care safely without violating safe distancing rules. Bottom line, my message for our community is Bronson is ready to care for you safely. If you have any questions, please call your provider. Thank you and take care.